Well, good afternoon, and thank you for joining us wherever you are for our Paws with Your Pet webinar, a panel discussion with experts from the Ohio State University College of Veterinary Medicine and Veterinary Medical Center. My name is Rustin Moore, and I'm the dean here at the college and will serve as the moderator. Just a couple words about logistics for our webinar today. All attendees are muted and we cannot see you. For you to present or submit questions that we may answer throughout the webinar, at the bottom of your screen, there is a Q&A button. That's where we will have you submit questions, not through the chat room. And we will have that monitored by our staff and feed those questions to us. So at this time, I would like to have each of our panelists briefly introduce themselves before we jump into answering questions that are probably on all of your minds regarding COVID-19 and your pets and animals. Some of the questions will be answered are those that you submitted as you registered to be part of this webinar, and then some other ones. So let's begin first with Dr. Roger Fingland.
Hi, I'm Dr. Roger Fingland. I'm the Executive Associate Dean and the Chief Medical Officer in the College of Veterinary Medicine.
Dr. Leanne Lilly.
Dr. Leanne Lilly. I'm an Assistant Professor Clinical here at the Veterinary Medical Center in Veterinary Behavioral Sciences.
And Dr. Jeanette OQuinn. Unmute.
We knew that was going to happen. I'm sorry, that was me. My name is Dr. Jeanette OQuinn. I work in the Department of Veterinary Preventive Medicine, where my work focuses largely on the health and welfare of animals in shelters, as well as veterinary public health. So infectious disease control is a large part of what I do.
Okay, thank you. So as we get started, I would just like to also direct everyone at some point to our COVID-19 and animals resource page, which is at vet.osu.edu, and that is being put into our chat room for you to use now or at a later time. So let's get started with the questions. I will direct each question to a panel member, and unless there is something that another panel member would want to clarify or add, we will move through the list of our questions. The first question or series of questions will be for Dr. OQuinn. We've heard a lot about the origins of COVID-19 and animals. So Jeanette, can you please briefly share some background information about the coronavirus and what we need to know, particularly as it impacts animals, whether domestic or otherwise?
Sure. The SARS coronavirus 2, which is the virus that causes COVID-19, is believed to have originated in China. It is most closely related to a similar coronavirus found in bats, although it may have passed through another species on its way to humans. Researchers are still looking into that. Though it started with animals, it is distinctly a human virus and passes readily from person to person. So I don't think that anyone can doubt that fact. Animals may, it appears, become infected, some species being more susceptible than others. However, it does seem to be a very minimal and rare occurrence at this time.
Great. Which species of animals do you feel or has been shown that are most susceptible to a potential COVID-19 infection?
So there's a little bit of research that's starting to come out and a lot more research that's currently ongoing. So we're going to continue to learn things day to day, honestly. Some of the recent research looked at cats, dogs, ferrets, chickens, and pigs, and they experimentally exposed these animals to very, very high doses of the virus, much higher than you would ever encounter in a natural setting. And they did find that cats and ferrets were susceptible and did develop some mild clinical signs associated with that disease. Dogs seemed more susceptible, or more resistant, less susceptible. And the pigs, chickens, and ducks seemed quite resistant. Again, this is one study. More studies will help us fill in any gaps and hopefully reinforce that first information that's out. I mentioned the high dose, and that's really important because what that tells us is what's possible, but it doesn't really tell us what's probable. So when we look at what's going on across the world right now and the many, many millions actually of cases of human COVID-19, and we're seeing reports of a very small handful of cats and dogs, and now recently a tiger, possibly lion, in a zoo. So that supports sort of what that research is saying, that cats may be more susceptible. Fortunately, all of those cases either had no clinical signs or very mild clinical signs, and the animals recovered without incident. So that's very good news as well. But when we look at the sheer numbers, I think it's pretty clear that the risk to animals is very low.
Great. And you mentioned signs. What signs or symptoms might a cat or a dog or other animal typically demonstrate if they had COVID-19 infection?
So again, no clinical signs is a possibility, just as with people. We would expect really respiratory signs, somewhat similar to what we're seeing. They might have a fever, they might just be not feeling good and not as active for a little while. They may have sneezing, maybe coughing, especially if it's a dog. Occasionally, we might see diarrhea as well. We're still learning again about this virus, and so all of those signs could be compatible. I think it's important to stress, though, that there are a lot of other diseases that are very common in our pets that have those very same signs. So if you're seeing those signs, it's much more likely that it's something else going on. But if you're reaching out to your veterinarian because your animal is sick, and there was a known exposure, you can mention that. Your veterinarian will be happy to have that information to consider.
Great. And the final question for you during this part of the webinar, do people have to worry about potentially getting the virus from their pet's fur? And if so, should they wipe down their fur with something? And if so, what would that be that you would recommend?
So right now, we don't believe that there's any significant risk from our pets, especially from the fur. So the virus, when we sneeze and cough and it goes out into the air, it settles on all of the surfaces. And we know that it can survive for different lengths of time on different surfaces. It's not believed to survive very long on pet fur. And again, it's not really considered much of a concern to pet an animal that may have been exposed. So if you have a pet that you know has been exposed, and again, this would not be something you would need to do on a daily basis or with pets that weren't exposed, but in an abundance of caution, you could bathe them, and any pet shampoo or mild soap would work. Or you could wipe the fur off with a wipe specially designed for animals. Okay.
Just a couple questions I see here. What if your pet has a pre-existing condition, say asthma, or maybe they're immunocompromised? Is there any special considerations in them like there are in people?
I think the best thing to do with our pets really is to treat them as you would any other member of the family. And so if you're sheltering in place, your pet should be sheltering in place with you. So don't let them out to roam around. They shouldn't be going to any parties with their friends that they usually have play dates with, the dogs or especially. So keep them in and limit that type of exposure. As far as being immunocompromised, again, we don't know very much about this virus and its impact, except that we're not seeing very many cases at all. So I think that's the most we can say about that right now, but the general precautions that you take to protect yourself and your family members will also protect your pets.
Great. Okay, let's move on to Dr. Leanne Lilly. Dr. Lilly, with most people home nearly all the time, pets must be enjoying the new COVID-19 lifestyle. I certainly know that my dogs, Travis and Teddy, surely are certainly loving the extra time and attention they're getting. And speaking of that, they actually had hoped that they could join us today for this webinar. So as they do that, are there any downsides to being at home more for your pets and all of the attention they are getting?
Yeah, so it's a great question. Some anxious pets, even if they like having their people around all this time, may be struggling to adapt to change because any change is hard for them. Oh, they're the boys. Oh, they're so cute. Any change can be hard for an anxious pet to adapt to, whether that's a cat or a dog. So we can see that particularly in both. And for many cats, sometimes we don't see those behaviors as anything that we would normally recognize unless it's an abundance of hiding or elimination outside the box. And those can also be signs of medical illness. So if your pet's exhibiting those, you need to talk to your veterinarian. More time at home can also be more time with family, and that can also mean more chance for inappropriate interactions from the pet's perspective. So we need to make sure that we're not sort of stressing out our pets by spending all of our time with them just because we're home all the time as well. And then everybody's out walking, which is actually really great for our mental health, and there are benefits to walking with your dog. And for dogs who needed more exercise and enrichment than they were getting, this is fantastic. But for dogs who are concerned about other people or other dogs, they may not feel safe on walks anymore, or they may not feel safe at home because now everybody's walking by their windows. You need to take that into consideration for those dogs.
Is there anything pet parents should be aware of and to do to help their pets during this time?
Yeah, so if your pet is struggling with any one of these, talk to your veterinarian, or if you've already worked with a positive reinforcement trainer, talk to them and just see about getting kind of an update on a plan. Pets, whether they're cats or dogs with separation anxiety, might really enjoy having you home all the time. But our hope is, of course, that at some point we get to go back to going out of the house all the time. So we need to make sure that we are taking the time to practice being separate from our pets. If your pet already has a departure routine, that you do that at least with some frequency, even if all you do is go for a walk around the block, or that's what you do before your grocery shopping. And then every pet at home should have a safe haven, someplace that they can retreat to away from the hustle and bustle, whether that's the hustle and bustle of the kids who used to go to school every day, or you or the other pets, where they feel safe. And then the 6 feet guideline, really for social distancing or physical social distancing, obviously we're doing virtual non-social distancing right now, should really, out of an abundance of caution, apply to two dogs interacting as well, because you don't know what that dog has been exposed to. And you don't know if that dog is typically normally engaged with other dogs, or would really prefer to have some of its own social distance from other dogs or people either.
Great, thank you. So the next question is a two-part question. The first part is for Dr. OQuinn and the second for Dr. Lilly. Jeanette, I know initially there were concerns that people would be abandoning and relinquishing pets for fear of the transmission of the COVID-19 virus from animals to people and perhaps other reasons. Has this happened, and what has been done to help prevent that? And what has happened with regard to the number of pets being adopted or fostered during this time?
That is a great question. The sheltering community really worked hard, I think, to prepare early for this. They expected that they would be receiving an increase in pets. One reason would be unfounded fears that people might be afraid of their pet passing that on to them. And again, as we just discussed, it's really not a significant risk at all. Any exposure that might happen with your pet, that same exposure is probably going to happen with you, and the people in our lives are a much greater source. And so I think that message has been sent pretty clearly, and we're not seeing as many animals as we had feared being surrendered to the shelter for those reasons, which is excellent. It's allowed us to reduce the numbers in shelters by increasing fosters in the community, increasing adoptions. And so adoptions have gone up. And shelters are using social distancing and safe techniques, virtual adoptions even, to do a lot of the work that would have been done face-to-face. So overall, that's it's been really great for the shelter animals to spend their shelter at home period in a home.
Great. Dr. Lilly, with numbers of pet adoptions and fostering going up, are there any special concerns or recommendations as it relates to puppies or introducing a new pet to the person's household?
Yeah, so there's sort of two different features that we want to consider. So one is that for any pet, adult in particular, but cat or dog, the adjustment period to a new environment is about 3 to 6 months. So it's better to go slow with a new addition to your home rather than assume that everything will work out, and to let them acclimate to their new environment. Because your home is very different from a shelter, and that's the whole point of bringing them into your home, but that also means that it's a change. And particularly being careful with high arousal type of activities, such as playing chase with the kids or playing chase between two pets. Those are things we want to sort of ease into rather than do on the first 3 to 5 days. For puppies, one of the concerns that we have is that there's that sensitive period that they interpret the world and learn what's good, bad, and indifferent, called the socialization period, and it's only 3 to 12 weeks long. It's very hard to have a very normal socialization period when nothing that we're doing right now on a day-to-day basis is normal, including whether or not they're left alone, but also how people are interacting with each other, how people are interacting with dogs. And so that is a concern, and finding either a virtual puppy kindergarten or continuing the socialization if you've already started it can be really important. And then either of them may get used to having us home all the time. So there is actually a PDF about when you're home all the time now, but you won't be always, on our COVID-19 resource page that I would encourage people to look at.
Great. Thank you, Leanne. We're going to move on to Dr. Fingland with a couple of questions. Roger, what if someone's pet needs medical attention during the stay-at-home and social distancing orders that we're all under? And what would be the steps a person should take to seek that care and guidance regarding their pet's health?
Certainly, there are many circumstances in which an owner might believe that their pet needs to be seen. What's most important now is that you call your veterinarian first. Even if you believe your pet is experiencing an emergency, it's important to call. And on that call, please tell us if someone in your household is ill with COVID-19 signs or has been diagnosed with COVID-19. Veterinarians currently are seeing mostly urgent and emergent cases. If you're not sure if that's what your pet is experiencing, certainly call your veterinarian. Very few elective procedures are being done now, and that's to save PPE for human use. On the call, your veterinarian may be able to do telemedicine. Telemedicine is a great way for you to seek care for your pet at this time. But remember that in Ohio, telemedicine requires a veterinarian-client-patient relationship. And that means that your veterinarian will need to have seen your pet in the last year in order to give you advice via telemedicine. It may be that your veterinarian suggests that you take your pet to an urgent care clinic or an emergency clinic. But if the recommendation is to take your pet to the hospital, there are a few things that will be different when you get there. Most importantly, follow the instructions that were given to you on the call that you made prior to arriving. And again, if someone is sick in the household, it's really important to tell your veterinarian that. It's quite likely your veterinarian will be doing curbside admission and discharge. So when you arrive, stay in your car. You will probably have been given a phone number to call. Don't enter the hospital, call the number. The reason that we do that is to protect you and to protect the caregivers. There are certain situations in which you will be allowed to enter the hospital, and certainly end-of-life care is one of those situations. A medical team member will come to your car. Don't be alarmed. They will be dressed in full PPE. Again, this is for your protection and for their protection. And they will take the collar and the leash, give that back to you, and put a hospital collar and leash on. They may even transfer carriers and use a hospital carrier. And please keep in mind that we won't be able to keep blankets or toys or any of the things that you want to leave with your pet. All the communication will be done by phone or email or text. So you will know all the time what's happening. You will still need to give consent for treatment. That hasn't changed. It will just be done in a different way. More than likely, it will be done over the phone with a witness. If hospitalization is necessary, you will be contacted frequently. You will be part of the care plan, but more than likely, you won't be able to enter the hospital. When it's time to discharge, your veterinarian will talk to you on the phone, let you know what needs to be done at home, what was done in the hospital. And again, discharge will happen curbside. So someone in full PPE will bring your pet to your car. Please, when you arrive, stay in your car. Remember, when you come to pick your pet up, you need your leash and your collar or your carrier. And the transfer will be made. Certainly, anytime you have concerns after discharge, call your veterinarian.
Roger, you were talking about various types of care. Could you let people, for those people, at least in our area, know what services we're providing with regard to emergency, urgent, and specialty care in our various veterinary health system facilities?
Certainly, the veterinary health system, which is VMC Dublin and VMC Columbus, as well as Marysville, is on emergencies and urgent specialty care only. That means we see emergencies 24/7. We see urgent care 24/7. Dublin sees urgent care during the hours that are posted on the website. And in certain circumstances, if specialty care is needed on an urgent basis, that can be arranged. Best to just call and find out if your pet fits in one of those categories.
And or call your primary care veterinarian. A question just came in, and this may be for Roger or Jeanette. What do we do if our pets' immunizations are due in April?
So I can take that one because we've been discussing this quite a bit in the veterinary groups, and what the recommendations are if you're a young animal and you're getting your first immunizations. That might be more important, but still can be delayed if you're able to protect them in your home from exposures to other animals. Talk with your veterinarian about what they're recommending. For those that are well immunized and we're looking at booster vaccinations, there's no problems whatsoever for our pets to delay that for a month or even 2.
Okay, wonderful. Going back to you, Dr. Fingland, what precautions should we take with our pets if someone in our household is diagnosed with COVID-19, meaning they test positive, and or if they are being quarantined while waiting on the results, and or if they've been exposed to someone who was positive? And so what would we do in that situation with regard to our pets?
Certainly. Let me first say that all of you horse owners, please call your veterinarian and ask about specific vaccines. It's mosquito season, and some diseases that horses get are carried by mosquitoes, and it may be that your veterinarian recommends that you go ahead and vaccinate for horses for some of those things. From the standpoint of taking precautions, if someone in the household is positive, remember the risk to animals is very low, and the risk from animals is even lower. There's no evidence that the virus is spread to people from the skin or the fur of pets. However, out of an abundance of caution, we recommend a few steps. First of all, don't put PPE on your pet. It doesn't help them and it doesn't help you. Restrict contact, practice physical distancing. Have someone who's not ill care for your pet if that's at all possible. But if you must take care of your pet, wear a cloth mask anytime you're around your pet. Don't share food. Avoid hugs and kisses if at all possible. And don't let your pet sleep in the bed. If the bed belongs to the pet, you may have to sleep elsewhere. Wash your hands before and after contact with your pet every time. And again, if you must take your pet to the veterinarian, call ahead. Make sure you tell the veterinarian that someone in the household is ill. Finally, it's a great idea to develop a care plan for your pet. What happens if you're not able to care for your pet for some period of time? Call a friend or a neighbor or a relative. Make arrangements for somebody to come to the house, pick the pet up, take it to their house, or care for the pet in your house. Have that plan in place so if you have to leave on an emergency basis, you don't have to worry about what's going to happen with your pet.
Great, thank you. Roger, that was a nice lead in earlier to people while they're social distancing, staying at home, etc. People are, in a sense, are becoming socially isolated. Questions have arisen regarding the role pets may have in helping keep people healthy and well during this time. So how can that happen? What we do know is that about 3/4 of households and 70% of people every day wake up to at least one pet or companion animal. And for 90% of those people who are like me, their pets are considered part of their families. We also know that women who are victims of domestic violence and other vulnerable populations like those who are homeless will not actually give up their pets in order to seek shelter. That really demonstrates the power and the strength of the human-animal bond. And interacting with a pet or an animal has been shown through scientific research and other evidence to have positive benefits on not only the physical, but also on the emotional and mental well-being of our people. For example, petting, snuggling, cuddling, looking into the eyes of your pet, many other types of interaction have shown physiologic changes in people's body. And that really has been shown to decrease certain hormones like cortisol, which is a stress hormone. It's been shown to increase oxytocin, which is a feel-good hormone. And that not only has been shown to happen in people, but some of those same physiologic changes happen in your pets or your animals. The good news is that some of these positive health benefits can be achieved by intermittent interaction. So it doesn't mean you have to necessarily be with the pet all the time to reap those benefits. Certainly, we talked a little earlier about walking your dog. Certainly that can be not only good for your own health, mentally and physically, but also good for the dog's health as well. I know that's true for Travis and Teddy. They love to get out, and I can tell you when I walk through the neighborhood by myself, nobody makes eye contact with me. And when they're with me, they come across the street to greet them. The important thing when you're walking your dog is to have your dog on a leash, and also to make sure that you maintain those proper social distancing recommendations. Interacting with pets or animals has also been shown to be very helpful for another population of people, and those are those youth who have some type of autism or on the autistic spectrum disorder, the Alzheimer's or dementia in those who are older, and also those who have experienced post-traumatic stress syndrome. So there's a lot of evidence emerging that those benefit from having an interaction with a pet as well. Being responsible for a pet, meaning someone who may live alone, they're isolated, it could be an elderly person. Simply having a pet gives a person a reason to get out of bed in the morning and to go about their business. It also instills a sense of purpose that is, again, particularly true for those who are socially isolated. And finally, pets provide great companionship, especially for those who live alone, or they may, because of these circumstances that we're under now, they just can't have either virtual interaction like this because they don't have the technology, but also for those who can't be visited. So those are some of the things that I think are really important as it relates to the positive health benefits on people of interacting with pets. We're going to move on now to Dr. OQuinn. This is a two-part question. If my pet is showing signs consistent with other pets and animals who have been diagnosed with COVID-19 infection, i.e. upper respiratory signs or things like that, should I seek getting my pet tested for COVID-19?
So the recommendation right now is that we not test general pets. There are certain circumstances where that might change. For example, at the zoo, where those animals were incredibly valuable and endangered. And so they went ahead and tested those animals. And there are some other circumstances perhaps where pets would be tested. But for the most part, if there is an infection, it's mild and they recover on their own, and they don't feel that there's a strong benefit to having that test done. That said, if your animal is sick enough to need veterinary care and you believe that COVID might be a factor, certainly mention that to your veterinarian, and they could take a better history to help decide whether testing would be warranted or not. Again, remember that there are so many other viruses out there that cause similar signs in our cats and dogs that are very, very similar to those signs that we've discussed. And so it is most likely something else. Remember, we're talking 3 or 4 cases that we know of in cats and dogs that could possibly be related to COVID. So this is certainly not something that we expect to see very commonly.
Right. And the second part of that question is, does that mean, so you mentioned earlier that coronaviruses are common in certain species, and particularly cats. Does that mean there's a treatment or vaccine for COVID-19 that my pet should get?
That's a great question too. There are several coronaviruses circulating in different animal species, and most of them stay within their own species. So there's a cat coronavirus and a dog coronavirus. We do have vaccines for some species, and those are not expected to provide any cross protection against COVID. So some people have asked whether they should be used in humans for that purpose, and they simply wouldn't work. So at this point, there's no benefit to those for COVID, but certainly they're useful for the purpose that they were developed for.
Great. There was a question that came in earlier after I asked Dr. Fingland about the different services that are provided through the veterinary health system. Someone asked if we could post those. I did post those in the chat for anyone who wants to look at them. But also please make sure you either go to our website or call to make sure that there aren't changes in those. So thanks for all of those comments and questions that you answered. We're going to now move on to some of the questions that have been submitted by our attendees. First, Dr. Fingland, several of our participants in this have actually work in the healthcare field and are concerned about bringing the virus home and infecting their pet. What's the risk for those individuals? And a sort of a related question that came up in the chat is, should we be changing our shoes or disinfecting them as we enter our home?
Certainly. First, thank you to all of you working in the healthcare field. Whether you're caring for people or pets, we sincerely appreciate your work and your sacrifice. As we have said many times, the risk to your pet is very low, even if you work in healthcare. It's best to just treat your pets the same way you treat your people. When you come home from the hospital, practice physical distancing, keep your work clothes, including your shoes and your socks, away from your pets. Wash your hands before you touch your pet, and avoid snuggling, holding, kissing, any of those things that you would avoid with your people when you come home from the hospital.
Great. Dr. OQuinn, we talked about including your pet in quarantine preparations, and one of our attendees wanted to know if there's a standard set of things that you should do in that situation to prepare, and also related to a first aid kit that might need to be assembled.
That's a great question. So it is important to consider your pets when you're preparing to shelter in place or to be self-isolated or quarantined for a period of time. Mostly you want to make sure that you have a sufficient supply of food and medications that your pet might need for the duration of that, recommending at least 2 weeks for all of those things. It's a good idea also to have a go kit for your pet in case someone else needs to take care of your pet. Should you unfortunately be admitted to a hospital, for example, everything that is needed is all in one place. And there's a great list of recommended supplies for that on our website that Dean Moore has posted. In general, you want to have a copy of their medical records or vaccination records, medication and food, as we've already mentioned. It's a good idea too, if you can, to get a prescription. Your veterinarian may write a prescription for you that could be filled at a human pharmacy in the event that they're not open or able to fill a prescription themselves. So just making sure that you have everything that they need as well as everything that you need for the period of time that you're going to be at home.
Great, thank you so much. Dr. Lilly, with the CDC recommending people who are sick isolate themselves from their pets, what do you recommend for pets, particularly cats and dogs, who might find it distressing to be away from their people during this time?
Yeah, so some of that goes back to what Dr. Fingland and Dr. OQuinn were saying about having a plan in place ahead of time. So if your pet, whether it's cat or dog, would be distressed by being isolated from you, but would be perfectly happy to go stay with a friend or family member where they weren't isolated from anybody, then that may be the plan you want to have in place. If that's not an option, or because you don't know anybody in town or don't have someone close, or because your cat or dog is uncomfortable with unfamiliar people and so that has to be isolated from you in your home, talk to your veterinarian before you need that stage, or you have to take that step, about what it would look like to help make your pet be comfortable in that situation. And if your veterinarian is stuck or needs a little bit of support with that, they can reach out to us. We're happy to help you guys with that situation.
Dr. OQuinn, there was a question that came in that, and this is about cat susceptibility, and this was related to the World Health Organization study that came out this Wednesday, apparently, which commented on potential cat-to-cat transmission. Can you comment on that?
Yeah, sure. So this is the same study that I referenced a little bit earlier, in which they experimentally inoculated cats and other species with very, very high doses of the virus. And this gives us some information about what's possible. So there were, I believe, 2 cats that became infected because of being in close proximity to the cats that they had experimentally infected. So this shows that it is possible. We don't know enough really to say that it's impossible, of course, because we have this to show us that it can be. So for those who wish we could say it'll never happen, we can't say that. But we can tell you, based on what we're seeing, that if it occurs, it's not very common, and it appears to be pretty unlikely, again, just based on what we're seeing in the cases that we are aware of.
Great. So another question that came in is someone mentioned that they were curious about how our college's veterinary medicine outreach programs have been affected by the COVID-19 situation. Because so many of the people that we provide services to through that program do fall in the category of those that are most vulnerable, the homeless, the elderly, and those that are financially challenged. And the person who submitted this certainly, along with many others, are worried about them and their pets. I'll just say, and then if anyone else wants to weigh in from the panel, unfortunately, back probably 2 or 3 weeks ago, we did decide that we needed to curtail or take a pause on providing those services. And that primarily was due to make sure that we were protecting those people from someone going in that may actually have the COVID-19 virus. We felt like it would be much better to protect them, not have contact with them, potentially spread that. Certainly some of the organizations we work with are continuing to deliver pet food. And if any of those people have urgent care situations, certainly there are ways through those organizations that they can reach out to get some of those services provided. We look forward to the day that we're able to restart those programs, because they are so valuable to the community, the people and the pets, as well as a really important thing for our students in our educational program. Jeanette, another question came in that says, I volunteer for a local rescue. People are abandoning pets in fear of COVID-19. Can you advise the best way to help educate the public on keeping their pets and family healthy and keeping them together?
That's another great question. I think the most important message really is that pets belong at home with us. That's the best place for them. Again, as we've mentioned throughout, while we cannot ever say there's zero risk, we can say that it is incredibly low. And it's really not significant in comparison to the risk that people pose every day. In other words, if your animal was exposed and able to get sick, the greater risk to you would be whoever exposed that pet, if that makes sense. And I hope that does. So just trying to put this in context, right? Our pets are almost an innocent victim, if you will, if they were to become infected. And again, it is very, very rare. So I wish that if I could convey one thing, it's that we want to take precautions to help protect them, and we should trust that those precautions are going to be very effective, because the risk to them initially is very, very low. So there really is no reason or no benefit to abandoning your pet at a shelter. it's not going to reduce your personal risk at all.
Yeah, great. Thank you, Dr. OQuinn. Another question, as we are asked to stay home and social distance from other people, many families are out walking with their pets. Should pet owners use social distancing rules with pets versus allow them to visit? Absolutely. Certainly, the social distancing should be both for you and the pet. And the reason for that are twofold. One, you should be walking your dog on a leash, and the leash shouldn't be such a long leash that they're getting away from you and making contact with either the person or the dog. And the reason for that is primarily probably, again, remember, animals are, although highly unlikely, there's a very low likelihood that it could be transmitted from a person to an animal, but it is possible, and therefore we should maintain the same social distancing guidelines for our people and our pets while we're out walking them. There have been several questions coming through about allowing their animals to go to daycare, start training, or do therapy visits. When do you advise they can do things like this? And what do we think regarding our Buckeye Paws, which is a new therapy dog program launched by the Wexner Medical Center for staff, and they have suspended that. How about we address that to Dr. Lilly as a starting point?
Sure, yeah. So daycare theoretically could be run sort of like a curbside service, but the question has to be defendable to the Ohio Department, Public Health Department, that that's an essential service, because the people in that daycare are potentially not observing social distancing in that regard. And then again, there is that potentially low risk that someone from an unknown COVID household could bring their dog to daycare. That dog could potentially rub it off on another dog and expose either the daycare workers or a different household to it. So it's probably not in best practice with social distancing for daycare at the moment. The same is true and even more complicated for training, because training typically includes somebody who's a professional standing in a room, going back and forth and interacting with a group of people and their dogs. And so that means having everybody in a shared airspace for a prolonged period, even if they're 6 feet away. Prolonged airspace sharing for is currently not recommended. And so we will end up starting to do those things live and in person, essentially when the Public Health Department and our heroes, Dr. Amy Acton and Governor DeWine, tell us that we can. And until then, many places are starting to launch virtual training. We are in the works of getting our puppy socialization class into a virtual format as we speak, and because we recognize that need, but we still all need to stay safe while we're doing it.
Great, thank you. Question from one of our alumni and veterinary colleagues. Basically, she asked, as a veterinarian working at a busy emergency clinic, we are seeing patients whose owners have symptoms of COVID-19. Is there risk to our staff members from those pets when we are working with them coming directly from a situation in which they may have been exposed? How about Dr. OQuinn?
Sure. So that goes back to the, can that virus be moved around on animals or objects? And we certainly know that it can easily be moved on objects. It is possible to move it around on an animal, although as previously mentioned, it's not believed to survive very long on the animal or be easily transmitted to a person through that method. But from the objects, the leashes, the collars, the people themselves, I think that certainly does present a risk. And the appropriate measures, as Dr. Fingland had described earlier, I think should be taken. Ideally, a person who is not sick in the household should be bringing the animal in for treatment, even if the owner is sick. And communications can occur remotely to make sure the owner is involved in all decision making.
Great. Dr. Fingland, we have a question here from a client who has a golden who has their pet on a clinical trial. He's a pet hero, and he has an appointment scheduled as a follow-up as part of that clinical trial on April 20th. The question is, what's the protocol, and should I plan to bring him in on the 20th?
There are clinical trials that are continuing. Call first, as we've said so many times. Very important to call before you come in for that appointment, and they'll tell you if anything has changed.
Great, thank you. Great question that just came in. What are your opinions or our opinions of the work of therapy dogs in hospital settings during this pandemic? This particular person says they have pulled all of ours from the setting as a precaution. However, this is a time when staff needs are at their highest with regard to emotional issues that they may experience, and just wanted people's thoughts on that. Jeanette, what do you think?
I think it's a real challenging question, right? Because you have to balance what's going to be best for reducing the risk of disease transmission with what the needs of the people are. And in this situation, I think that everything we can do to prevent moving this virus around needs to happen. And I think the stay-at-home orders should apply to animals as well as people.
Great. Dr. Lilly, basically one question, wondered if you could elaborate and give some examples of concerns that people could expect during the transition when we go back to work. This is particularly, those things that when we go back to regular schedules, what might be things that we should be looking for, especially for those pets that really, really enjoy being around us all the time?
That's a great question. So there are a wide range of signs that we can see when pets go through a change and are anxious about it. Classically, for separation anxiety, at least in dogs, that can run the gamut from drooling, panting, pacing, vocalizing, and of course destruction and elimination in the house. And destruction and elimination in the house are very easy to identify because they're there when you come home, so you can still see them. But one of the easiest ways to check in on your pet and see how they're coping with you departing as we depart less and less is just to video them. And that's easier for dogs because they tend to exhibit a bunch of behaviors that we can actually see and measure, such as panting and pacing or drooling. Cats often hide, and so sometimes what you see when you attempt to video a cat to see how they're coping with something is no cat, and then you have to decide, is that because the cat is sleeping on the bed and that's not where you put the camera and that's normal for the cat, or is the cat hiding under the bed because you haven't come home and it's worried about it? So that can be harder for cats, but certainly we can see cats struggle with that. And then eliminating outside the box is another very classic cat move for them being stressed. It's not out of spite. They're not angry that you've left the house. They suddenly feel unsafe because you're not home anymore.
So we'll just answer a couple quick questions before we start to close. There's a question that's been in here for a while. Maybe this could go to Dr. OQuinn. Any concerns about very sweaty horses and the potential to transmit COVID-19 in that manner?
So I'm not sure I fully understand the question, but we don't expect there to be, we don't have any evidence, let's say, to show that there's any risk of transmission to livestock or horses. And I would add that being sweaty isn't going to increase or decrease that. So I don't think that's going to be a concern. What we see with some of the barns that are closing to the public are not necessarily because of a concern about the animals. It's more to reduce the contact between people and reduce the number of people in the barns so that they're not spreading it from person to person.
Okay. There's also a comment in here about a surgery that is actually, it was a dental and a cancerous tumor removal, and basically they were asking about, are all elective surgeries like this still discouraged? Certainly, if it's a cancer tumor removal, that may not necessarily be considered elective. You would need to follow your veterinarian's advice on that. For truly elective procedures, those are being discouraged from being done, primarily to conserve personal protective equipment or PPE. But again, everybody should consult their veterinarian on that. There's a lot of other questions in here, and we also want to be cognizant of time. There was a question, and I'll just remind everybody, basically, they were wondering what resources do we recommend for continued evidence to follow. I would again ask that or suggest that you go to our main website, which is vet.osu.edu. And we, right at the top of that, there is a banner that allows you to click to read more, and that is our COVID-19 and Animals resource page, and we update that on a very regular basis. So at this time, I'd like to ask each panelist to provide a closing thought or comment, sort of like a nugget that each of our attendees could take away from this regarding the topic of COVID-19 and our animals. We'll begin with Dr. Fingland.
You've heard it many times, but please remember, the risk to your pet is very low, and the risk from your pet is even lower. Anytime you have a concern about your pet, call your veterinarian. Even if it's an emergency, please call first.
Okay, great. Dr. Lilly, what's your closing thought or comment?
Very much similarly echoing, right? Treat your pets like family. Remember that this is a hard change for them too, and any change is hard. Be patient with your pets. Make sure that they're getting their behavioral needs met in our new environment, and reach out to the professionals if you have questions about how to do that, and be gentle with yourselves as being gentle with your pets.
Great advice. Dr. OQuinn, how about you?
I think it's really important to remember that the precautions that we've all heard about over the last few weeks and have been employing are going to be just as effective at protecting our pets as they are at protecting us. So when you're taking care of yourself and your family, you are taking care of your pet.
Great. Well, my closing comments are really around the fact that it's really essential that we acknowledge the importance of pets and animals to people during this period of social distancing and isolation. Animals, as we said, provide companionship and can improve the emotional and mental well-being of our people. It's important to recognize and remember that 90% of us who have pets consider them parts of our family, and we should treat them as such as it relates to COVID-19. However, unless you are diagnosed with COVID-19, you've been tested and are waiting the results, or you have signs that might be consistent with them, certainly I think it's okay and it's safe for you to be around your pets in your home, provided you're following all the other precautions. That means snuggling, cuddling, and all the other things. We know there are definitely health benefits for this, and this is a really important time for people to reap those benefits. So I'd really like to thank everyone. We at one point had almost 600 people on during the same time who joined us this afternoon for our webinar titled Paws with Your Pet. Based upon the responses of this session, we may choose to have other sessions in the future as the COVID-19 pandemic evolves, as we learn more about the importance and impact of COVID-19 as it relates to our beloved pets and other animals. We will follow up with attendees with a post-webinar survey, and we would love for you to provide us with your candid feedback so we can best serve you and others in the future. A question did come in about, is this being recorded and will this be provided, made available publicly? I do believe it is being recorded. So yes, we will do that. And certainly for those people who are not only registered, but are participating, will receive a link for that. At this time, I'd like you to all pretend like your microphones are on and that we can see you, and join me in giving a huge virtual applause to our incredible panel for spending this time with us and sharing their expertise and wise counsel. So with that, we wish you a relaxing and restorative Easter holiday weekend. Please remember to practice social or physical distancing recommendations and other preventive measures, such as hand hygiene, self-quarantine, wearing a mask while in public, and other methods to keep you, your family members, including your pets, healthy, well, and safe. So thank you, and go Bucks!